Cervical cancer is the 11th most common cancer in women. Under 35 is the top cancer, but despite lots of campaigning, 1 in 3 women in the UK are still not coming for their cervical screening.
I'm Dr. Alex Gawthrope, and here in our practice in sunny Blackpool, we have seen a dip in the patients coming for cervical screening. So if there's one thing you want to take away from this message, I'm calling on everyone who has a cervix, women, trans men, non-binary people with a cervix. If you're not up to date with cervical screening, please contact your GP surgery, get an appointment with the nurse, let's get it done. We hear a lot, oh, the doctor's surgery is too busy, I don't want to bother them. So if that's you, forget that. No, we want people to get cervical screening done, and we'd much rather be doing that than have people develop cervical cancer that may have been preventable. So, pick up the phone, book online. Our surgery at Newton Drive has nurse clinics running every week for cervical screening. Similar goes in our area for Leighton Medical Centre, Martin Medical Centre. There are even evening appointments and weekend appointments in Blackpool for cervical screening in case you need to fit it in around busy lifestyles. Many sexual health clinics run cervical screening services too. To do it today and get it booked in, it might be life-saving. Sounds dramatic, but it is absolutely true. Now, if you don't have a cervix, are your loved ones up to date with cervical screening? Sometimes we find that partners and family are the most important people in raising awareness of cervical screening. I had to remind my wife for months. She kept putting it off as she didn't feel comfortable doing it. And I get it, most people don't fancy the idea of a stranger looking at your bits.
But when I did finally get it done, I did need treatment, and the NHS has potentially stopped me from getting cervical cancer.
So that's the main take-home message. And if that's all you're going to take away from this video, you're up to date with cervical screening, or you're going to get in touch with your GP, absolutely fine. We can stop there. But if you are on the fence, let me give you a little bit more detail. Let's talk about what the test is, why it's important. We'll talk about HPV, or the human papillomavirus, and also what happens after you've had the test. Cervical screening is not a test for cancer. It is a test to help prevent cervical cancer before it has occurred. Prevention is better than cure, right? Around 2,000 lives per year are saved by cervical screening in England each year. Now you might hear it still being called the smear test, by the way, and it's basically the same test, apart from the smear test didn't used to check for cancer-causing viruses. Cervical screening is just a more modern version of the same test.
Between the ages of 25 and 65, individuals registered with the NHS as female are invited to undergo regular screening. The letter is sent about 6 weeks before the test is due. Women aged 49 and under are invited every 3 years, whilst women aged over 50 invited every 5 years.
Now you might have noticed a problem there. We said invites will go out to those registered female with the NHS. NHS IT systems are a little bit backwards in that they won't pick up men with a cervix, and there isn't a simple way of registering as non-binary currently. So rather than NHS screening services sending automated invites, the GP surgery would have to manually invite such individuals, which would either mean the surgery needs to have the right systems in place, which isn't necessarily as simple as it should be, or the patient come forward to request cervical screening. I should mention there are also some specialist clinics with a focus on transgender health who also offer cervical screening, and I've put some of the details in the link in the description. Needless to say, this does create a health inequality, and the NHS are well aware about this. Cervical screening tests are checking for human papillomavirus, and that's because 99.7% of the time, cervical cancer is caused by the human papillomavirus. You might have also heard that abbreviated to HPV. Now this is a group of viruses that is passed to each other through skin-to-skin contact, usually through sexual activity.
80% of us will contract HPV at some point in our lives. It's easy to get and it's easy to pass on. You can get it even with the use of protection, and you can get it the first time you have any sexual contact. Because it's so common, healthcare professionals don't tend to consider it in the same category as sexually transmitted infections. So that means having HPV doesn't mean you are dirty, and it doesn't mean your partner has been unfaithful, as the virus can lie dormant for years.
Now, not all human papillomaviruses cause cervical cancer. So the ones that do are what are called high-risk HPV. Now most people won't know that they have high-risk HPV, as it usually doesn't cause any symptoms.
So then, why isn't cervical cancer way more common?
Well, usually being exposed to high-risk HPV isn't actually a problem, and the immune system simply clears away the virus. 9 times out of 10, the body can clear the infection within 2 years. But occasionally the body doesn't, and then that's when it becomes a problem. We don't really know why. Some people can clear it better than others. It might relate to the particular type of HPV that somebody gets, or their immune system, a person's age, or factors like if they smoke. Regardless, it's this persistent infection of the cervix by high-risk HPV virus that causes precancerous changes to the cervix, eventually can turn into cervical cancer. And that process can occur over the course of about 10 to 20 years.
So that means you've got a time window to potentially stop this process, and that's where cervical screening comes in. If you can test the cervix for HPV, you find people who are more at risk of cervical cancer. Now, you can't actually cure the HPV itself, but you can treat abnormal or precancerous changes to the cervix caused by HPV. If you can do that, you can prevent cervical cancer from happening.
Now, most patients prefer a female for the test, so I don't actually do cervical screening, and of course, I've never had the test myself. So I'm going to hand over to our own nurse, Perry, to explain how cervical screening is done.
Cervical screening is so important, but of course a major barrier is that many people find the idea of cervical screening embarrassing or awkward. It can be uncomfortable for some women too, although most women don't experience any pain. So we try our best to make things as comfortable as possible for you, and if you have any questions or particular preferences, we will try and help. Or perhaps, if you are particularly worried, you could ask for a longer appointment to go through things slowly and ask any questions. You can stick some headphones on or bring a friend, whatever you need to make you feel comfortable. Some people may want to choose the gender of the clinician performing the test. In our practice, usually it will be a female nurse doing the test, and you can have a chaperone present if you wish. Usual rules around privacy and confidentiality apply, so we don't go shouting to everybody about why you are here. We know that this may be a particular concern for trans men, for instance. If you have a history of smears being particularly painful, it might be worth mentioning, as perhaps we can use a smaller speculum, or we could use some additional lubricant, or sometimes, and particularly if you are prone to vaginal dryness and irritation, a course of estrogen cream or a pessary can be used for a few weeks before the cervical screening appointment, and then stopped 2 to 3 days before the test itself. As a last resort, women can be referred to a specialist for support if it is impossible to perform the test at the surgery, although this is rare. During the test itself, we will pull a curtain across, lock the door so nobody walks in. You'll usually lie on your back, your lower half is covered by a clean sheet of paper. You usually bend your knees with your ankles together and flop your knees apart. Sometimes we might ask you to sit on your hands and make them into a fist. This is to help visualise the cervix. We keep you covered up until we are actually doing the procedure, so you are exposed for the least amount of time. The nurse or clinician will insert a speculum into the vagina, which looks a little like a duck's beak. They are usually plastic, although can be metal, and there are different sizes. We put lubricating jelly onto the speculum to make things a little more comfortable. The speculum is opened up so that the healthcare professional can see the cervix, which is a round tubular structure. A plastic rod with a soft brush on the end is put into the vagina, and the brush is rotated upon the cervix. Occasionally that action can cause some light bleeding or spotting, which usually settles within a few hours. The brush is put into a bottle of fluid and sent to the lab in Manchester for testing for the HPV virus.
At the lab, the sample is tested for HPV. If HPV is found, then the lab then proceed to check for any abnormal cells. If abnormal cells are found, then you'll be referred for a colposcopy, and this involves using the speculum just like in cervical screening, but instead this time a microscope is used which stays outside the body and looks at the cervix closer up. Now, depending on what abnormalities are present, the colposcopy, some patients are then asked to have simply a follow-up checkup. Sometimes a biopsy is taken, but also treatments can be given at the time, such as removing the abnormal cells.
In my case, after I was found to have abnormal cells, I was offered a large loop excision, which uses a thin wire with an electrical current to remove abnormal and precancerous cervical cells. This is a common treatment. It sounds gruesome, but they do anaesthetise the cervix. I would say it was comparable to the discomfort of cervical screening.
So that is if abnormal cells are found on the cervical screening test. Meanwhile, if no abnormal cells are found, a follow-up cervical screening test is arranged for 12 months' time, and this is to see if the immune system can clear the virus itself, just like I mentioned earlier. If you happen to have the virus detected on 3 consecutive times during the cervical screening test, but without abnormal cells, then a referral to colposcopy is also done, as this is suggestive of a persistent HPV or a viral infection that the immune system is struggling to clear. If you do not have the HPV detected on the cervical screen, then that's a normal result, and you'll be simply re-invited for your cervical screening as normal, so that will be every 3 years between the ages of 25 and 50, and every 5 years between 50 and 65 years old.
Why is screening not offered under 25 and over 65?
Well, it's a controversial area, but under 25, the research evidence suggests that it doesn't actually reduce rates of cancer diagnoses. Over 65, if you've attended the previous cervical screening appointments and they've been normal, then because it's a slow process from HPV to precancerous cells to then cervical cancer, it's unlikely that they will then develop cervical cancer. The exception is that if somebody has never gone for cervical screening, then a person over the age of 65 is actually still eligible to have the tests. And also, if their last screening result was abnormal, in that HPV was detected, then they will still be followed up.
Why can't I just do the test myself?
Watch this space. It's been looked into, it's been trialled in other countries as well, and it might be something that's offered in the future.
So I've had the HPV vaccine. Do I still need cervical screening?
Yes. Now, the HPV vaccine is actually a really exciting program, because that, together with an effective cervical screening program, one day it might be possible to more or less eliminate cervical cancer as a public health problem. But the problem is the vaccine is not 100% effective in eliminating HPV infections, and it doesn't protect against all types of cervical cancer. So recommendations currently are to continue. However, potentially the frequency of the testing might change in the future. Again, watch this space. I hope that explains more about why cervical cancer screening is so important. If you have any further questions, there's lots of help out there. Joe's Trust is fantastic. Also, Macmillan Cancer Support and Eve Appeal both run helplines too. Links in description. Or, of course, contact your surgery, and certainly for those patients based at our surgery, Newton Drive Health Centre, also Leighton Medical Centre and Martin Medical Centre in Blackpool, our practice nurse team would be more than happy to answer any queries and assist. Bye for now.